Hello and welcome everyone to a new video. Today I'm going to take you through how to use EMIS. EMIS is one of the computer systems that we use in our GP practices. It's not the only one. As you can see here, there's System 1, Vision 3, and EMIS, but today we're just going to take you through how to use EMIS. So this icon right there, EMIS Web, is how EMIS looks like. And when you press on it, it starts loading right there. And there are basically two ways to log into EMIS, either by using your smart card and putting in your passcode, or by using your username and password. Most of the time, we should have our smart card with us, and it just immediately logs you in, because it's also important for prescriptions and so on. But if you've forgotten your smart card for whatever reason, or it's not set up yet, you can just simply use your username and password to log into EMIS. As soon as you log into EMIS, your dashboard comes up. And this is basically your home page. The most important part in your home page as soon as you start your clinic is your appointment book. And your appointment book is what shows you your clinic all throughout the day and the patients that are booked in. So it looks like a calendar icon. You can either pick it from the launch menu or you can press on it on the toolbar right here. As soon as you press your appointment book, your appointments for the day are going to show up just like that. So as you can see here at the right image, you have all your appointments for the day. Usually you'll have the patient's name right there and their complaint right here in the reason for the booking. And if you're a fully qualified GP, we usually do 10-minute slots. So as you can see here, these are all 10-minute appointments. But if you're starting as an ST1, ST2, you'll be expected to start with 30 minutes at least. Okay, so as soon as a patient comes in, you're going to see a red icon next to them, which is marked as arrived. The patient can either check in themselves or they can be checked in by the reception members. So as soon as there's a patient that comes in again, you're going to see an A mark next to their name at the beginning of their name, and you'll know that your patient has arrived. So you want to send your patient into your clinic. You're just going to simply do it two ways, either by right-clicking and just pressing on Send Patient In, or if you go into on the patient's name and just press S on your keyboard. So as you can see here, I have a patient that came 10 past 2, and I'm just going to press Send Patient In to start this consultation. As soon as you start your consultation, this is how the homepage looks like. And you're going to press OK, and you're going to start your consultation. When starting our consultation, usually in the toolbar right there, we pick History, Examination, and Comment. This is the standard that most of the GPs pick, and we're going to start writing in each category what we need exactly. So this is an example of a history that we've taken from a patient. So we're going to write the patient's presenting complaint right there. If a patient is coming in with someone, you're going to write seen with their parents, seen with their partner, seen with another doctor. So you need to write if anyone else is present in the room. And then you're going to write their presenting complaint, and then you're going to take a bit of history. And as you can see, the history here in a GP setting is not as detailed as the hospital because we already have the patient's past medical history and medication in our record, so we don't really need to go over it again or rewrite it unless it's changed for whatever reason. So you're just going to take a short and simple history, make sure to rule out all your red flags, and make sure if the patient is saying anything, just quote them. So here the patient has reported sharp like being stabbed, so I'll just put it in quotation mark, whatever the patient says. In our comments section, we usually write our diagnosis or differential diagnosis, and we write our management plan. And that is including our safety netting as well. Okay, so this is how it simply looks like. And then I'll show you how to do the examination because the examination bit has a bit of coding that we do. If we're definite about the diagnosis, then you can press on problem and write the diagnosis. For example, if we're sure this is sciatica, then we just press problem and we code it and we put sciatica in so it goes into the past medical history of the patient. If you don't code the problem, it's not going to be recorded. So when you're going into the examination bit, whatever you write in comes as a form of code. And for example, here I want to write the temperature. So as soon as I write tympanic, this pops up. And when you press on it, this is how it shows up, and you just write the number that you've recorded. And as soon as you're happy and you're okay with it, you just press on this arrow right here and it saves it immediately to the consultation. Another example right here, we've written the tympanic temperature. We just want to write the pulse. There's a few options that you can pick from. And again, as soon as we're done, this is how the examination bit looks like. So these are just the coding into EMIS, and some of the investigations or the records that we have here can go through into the investigation bit of the patient. So at least if someone is searching, they can easily find these examination bits or the history part of the patient. So this is a full examination that we've taken. We've written everything, and we're happy with our history and examination for this patient. So we just want to move on to our next step. And next step would be picking some investigations for the patient. So if you want to pick some investigations for the patient, you just go into test request right there, and you press on online test request, and then you pick the hospital that's affiliated with your practice. So for us, it's Lancashire Teaching Hospital. We're going to press on it, and all the test options comes up right there. So you have your bloods, which is under pathology. You have your radiology. And also under pathology, you don't only have your bloods, you have your microbiology options, so like your stool and urine and swabs, all that you can pick. So whatever you need, you just click on it. Make sure you've ticked it. So you just press here, whatever you need. And then it takes you through to this page right there. So as soon as you picked all your investigations, you need to write the clinical details, so the reasoning for doing this investigations. Let's say for the purpose of this video, we're just going to write monitoring right here. So we're going to write monitoring. We're going to pick when the sample is collected, and most of the time, if it's bloods, it's going to be collected later on. And then we're going to press down here, accept request. As soon as you press accept request, there's two options, either to print out the labels and give it to the patient, or you just save it to your record and that's it. So I've done my investigation part, but I want to prescribe some medication. So as you can see right here, you're going to find the medication option here. And when you press on it, this page comes up. So you have the name of your medication, the dose, and the quantity. So when you write any medication, for example, let's say we're writing Ramipro, a few options comes up, different doses and different forms. You're gonna click on the forms and dose, and then it shows something like that. So for this patient, we've picked lansoprazole 15 milligram to be taken once a day, 28 capsules, and our prescription is ready to go. Now, an important part in prescription is that you can send information to the pharmacy or to the patient themselves. So, for example, for this patient, we don't want them to take the medication unless they give us the stool test. So we're just going to write, please only start after giving the stool test. Of course, this information, you've already said it in your consultation, but you just want to make sure that it's documented as well in their prescription. If you want to send a certain information to the pharmacy, for example, this is a one-off script, or please don't give it now, or whatever you want to write to the pharmacy, again, you're going to write it here in this section right there. EMIS is really good at picking up alarms. So if there is any kind of contraindication or any warning, that's going to come up here. And it's also going to come up when you pick the medication. So just make sure that you read through it and make sure that you're confident and happy with your prescription. If you're happy with your prescription, you just press on issue, and the prescription either gets printed out or it gets sent automatically to the pharmacy of the patient's choice. Okay, so we've done our investigations, we've done our medication. We now want to do our referrals. So if you want to refer a patient anywhere, we go through documents, you press on create letter, and then there's a few options that comes on. So it depends, each practice have different templates. For here you have our 2-week rules, we have our ADHD, we have a few options. If you can't really find the options here, you can just click on the search button right there, and you can actually search through what kind of letter you want to send it through. If you're just typing it in, you can either type it into your consultation or type it in a Word document and task it to your secretaries. So as soon as you pick whatever template you want to fill in, you just press on OK, and it comes something like that. So this is an example for a referral that's under acute referral. So it's just a written document. So here I'm referring to gastroenterology. So I'm going to write Dear Gastroenterology or Dear Colleague, whatever you want to write your head title. And then I would write why I want to refer this patient. So I would appreciate you seeing this patient, who, for example, is coming with constant abdominal pain. We've tried this and this and that, and it's not helping. So we think it would be beneficial for this patient to see you. Okay, and as soon as you've done with your referral, you save it. So if you go through the press on file right here, and you just press on save, and it goes automatically into the patient's record. Now we've done our referral, but we'll need to task it. So when you do your referrals, the secretaries are the ones that send it, so you need to task them to tell them to send it through. So in this icon right here in your toolbar, you just press on add task and you pick on the task type. So usually if you press on this arrow right there, you're going to find an option as referral. And when you press on it, this means that you're sending a task to the secretaries to refer this patient. You're going to pick who to send the task to. So from here, in the search button, you're going to pick secretaries, and then you're going to send it through right here. You're just going to press down there on send, and it gets sent to. Now, an important thing to know, two things really here. Do you want all the secretaries to action it, so all recipients to action the task? Usually no, so whoever gets it just actions it. And the other thing, is it an urgent referral or is it an urgent task or not? When you're doing your 2-week rules, please make sure to click this option right there under urgent. All other referrals are usually just routine. Now, important thing to know about tasks, it's not only for referrals, it could be for booking appointments. So if you want to task the reception to book an appointment, you can send it through here. If you want to task someone about a certain case, for example, one of your colleagues has seen a case and you just want to discuss it or you just want more understanding, you can task them as well and just ask them for an explanation or ask them to help you with a certain thing. So tasks can be used in many options. It's not only for sending referrals. So we've done our task, we've done our referral. Now let's say you need further support. So as you're all aware, unfortunately, the wait in the NHS can take up to a whole year. And you think, for example, that this patient cannot really wait a whole year. You can actually message the secondary care specialists, and we do it through the advice and guidance option right there. So I'm going to take you a bit back just to show you where you can find it. So you can find it right there under View My Record. So if you press on Advice and Guidance, this is the messaging system that you can send to the hospital. And as soon as you press on it, a few options comes on. So you pick the department that you want to send the message or query to. And as soon as you press on the department, then you'll type in your message and just press send. It's exactly as referring a patient, but the difference is that you want an instant answer. So let's say you've seen a case, a rash, for example, and you're not really sure what to do about it. You've tried a few options and it's failed. You've done the referral, the community referral, but you just want the dermatology to give you a plan until they're seen. So you press on dermatology right here, and you write your message, and you can actually attach the images to your message and just send it through. You can do this with a lot of departments. Not all the hospital wards or departments are actually available on advice and guidance, but I would say 90% of them are there. So use this option wisely. It's very, very helpful. I personally use it almost every day, just to revise plans, just to sometimes chase referrals, have a better understanding of the patient, and so on. Now we're coming to the end of our consultation, and we have really two options, either to save the consult, or if the patient is coming in with another problem, you just press next problem, and you go through and do what we've done at the beginning of this video all over again. Now, most of the time, GP appointments are one problem per appointment. So if you feel like you're running out of time and you cannot really do another problem, then just simply say no and to ask the patient kindly to request another appointment at the reception. However, you have to be careful with this as well. So if you've seen a patient who's coming with a rash And towards the end of the consultation, they just tell you, oh, I have another problem. It's chest pain. Unfortunately, it's not something that we can dismiss. So it's a good practice at the beginning of your consultation to just ask if the patient has many problems. If it's a yes, just tell them we're going to discuss one thing today. If you feel like both problems are simple, then let the patient pick themselves what they want to discuss. But if you feel clinically there needs to be one case to discuss that's more important than the other, for example, coming with shortness of breath or chest pain versus coming with hair loss, then of course, shortness of breath and chest pain is the priority here. Okay, so we've ended our consultation and we're just going to save the consult. Now, a good thing about being a GP in general, it's not only under EMIS, any GP in any practice can message their patient. And we simply do this through an application called Accurix. So this is how Accurix looks like. As soon as you log into EMIS System 1 or any application that your practice is using, Accurix immediately logs in. And when it logs in, it gives you options to message your patient. So if you press on this icon right there, this is how it comes. It means I want to send a message. Automatically, when you're on the patient, their name is going to be here. And it's just going to ask you to go through their number, make sure things are okay. And then you can message the patient two ways. Either by picking one of the templates that's already in the Accurix. So if you press right here in the search and you write, for example, as you can see here, a written photo, automatically a few templates comes on. So I can pick photo for our upcoming telephone consultation, send a photo, whatever I want to, or I can just type in the message myself. When you press on the templates, an automatic message comes on and you just press send. Now, when you're pressing things like send photo or send whatever, make sure that this icon right here, allow reply, is actually picked so the patient can reply back to you. And normally you get the reply of the patients right here. So when they reply back, you're going to find that a mark comes up here and you know that the patient has replied. And whatever you do, just make sure that these are saved into the patient's consultation. Okay, so this is a really good way of messaging the patient. Now, another thing that I've not really mentioned is actually messaging your own staff members or colleagues in the same practice. I'm going to show you how to do it, but I'm just going to go through the toolbar again. So when you're picking a certain patient, there's a few options that you can pick in order to go to the patient's history. If you want to see previous consultations, you can pick it right here. So all the previous consultations are going to come up and you can read through the patient's previous consultation and have a better understanding of this patient. You can actually search. So if I press on consultation and I press on search, I can write certain things. Let's say I've seen that this patient I'm going to meet this patient at 9:30 and they're coming with abdominal pain. If I want to know if they've come with the same problem, I just press on the search button and I type in abdominal pain and all the consultations that are related to abdo pain are going to come on. Okay, so this is a quick and easy way to go through the patient's consultation. If you've seen this patient before and you want to go through your own consultation, just to revise your management plan, then you're going to press on My Consultations right here, and it only picks your own consultations for this patient. Another important option to pick is medications. If you want to go through the patient's medication list, you just press on medication, and all the patient's medication list are going to come on. If you want to see the patient's past medical history, you can do it through problems or summary right here, and it takes you through all the patient's past medical history. If you want to check their investigations, which also includes their weight and height and BMI, it comes here under the investigation icons, and you can go through it and see what has been done for this patient so far. So these are the most things that we use in this consultation bar. If you want to edit the consult for whatever reason, then you can do it right here. So for example, let's say you're running late and you've not written everything completely, you can actually save the consultation and get back to it later and just add on a few more things. If you want to delete a consultation, you can do it right there, but be careful with this option. You only want to delete something that's necessary to delete. Okay. And I think this is all for how when you see a patient and go through the consultations and all that. But there's a few options for yourself, which are at the bottom right there. So if you can see here, if anyone's sending you a task, remember when we spoke about tasks, you'll find it right here. So if you press on your taskbar, you're going to see how many tasks have been sent to you and what exactly they need from you. So if the reception or secretaries or your colleagues are sending you anything to have a look at, it's going to be right here. Your own lab reports, so whatever investigations you picked for the patient are going to come right here. And documents are going to come right there. These are the most things that we use. When you are an ST3 or you're doing on calls, you're going to be asked to do some of the medicine management, which is the prescription. I'm going to explain it in another video, but these are all the icons that we basically use. Now, going back a few slides just to show you how to message your own colleagues. So if you can see this icon right there, which looks like a notepad with a pen on it, this is how you can message your own staff members. So if I want to send a quick message to one of the staff members, for example, your supervisor, your on-call GP, your reception, or your secretaries, you can use this messaging system. It's exactly like sending them a message on WhatsApp or any social media platform. You just press on it and you press send, and it goes immediately to the person. And this is the option that we use if you want an instant answer. For example, a patient has arrived, you're calling them, they're not outside, and you want to message the reception, where is the patient? For example, let's say this is one of the cases. You have a case with you and you want one of the seniors to come and have a look. Again, you can use this icon right here. Can you please come to this room? I would like your opinion about this patient, so on. So these are the things that are need more urgent reviews. So we've come to the very end of our video. I hope this was helpful to you all. And this is how to use EMIS. If you've liked this video, just please subscribe, like, and comment. And if you have any other suggestions that you need for your GP training, just let us know in the comment section below, and hopefully we'll try to make a video for it.